October is Eczema Awareness Month, and it's estimated that 1 in 10 individuals will develop eczema during their lifetime. Here to share more information with us is founder of Long Island-based Borealis Dermatology, Dr. Naveen Arora. Thank you so much for being with us, Doctor.
Hi, thank you for having me.
You're welcome. So what exactly is eczema?
Yeah, so eczema is a very common non-contagious skin condition that can take many different shapes and forms depending on ages and races of the individual who's affected.
So what does it look like? I've heard of like little patchy areas on the skin, things like that.
Yeah, it can take definitely a patch form, such as nummular eczema, which can be these red, circular, itchy areas, typically in the legs or arms, or it could affect the creases of your elbows or knees, sometimes around the neck. And in babies, it could affect the cheeks or the scalp in particular. So it really depends on the age and also the race of the individual that we're treating, because it could take different forms in different races also.
So how is eczema treated medically?
Medically, we fortunately have a lot of options. We have prescription creams, ointments, injections, pills, even medical light therapy.
Yeah, I've seen some commercials for something called Dupixent and Rinvoq.
Yes, those are, and I tell my patients now is a good time. If you have eczema, it's a good time to come in and get treated, because we have treatments that when I was training back in '07, '08, we just gave steroids and light therapy. Now we have these wonderful immune modulators that can do miracles with people's skin who are suffering for years or decades even.
Right.
And those are two medications that, are actively used and I actively use and have seen wonderful results with.
Gotcha. So what can people do at home on a daily basis, and what should they not do?
Sure. Habit modification really is an important aspect of eczema management. And that includes what I always tell my patients: shorter showers, cooler showers, take it easy with the loofah washcloth. People really go to town, then they come out, they're really dry, itchy, red. So short, cooler showers. And then when you hop out, really lotion up. Those are really important things. If your house is dry or you have forced air, using a humidifier in the room is also very helpful to maintain that ambient humidity to prevent the skin from drying out as quickly, which can result in eczema exacerbations.
And doctor, does it present itself differently with people who have darker complexions?
Sure, it definitely can. In darker complexions, it's less red, it's more of a deeper purple.
Okay.
Also, different areas can be affected, typically more commonly around the neck, and they can have different presentations, such as more inflamed bumps called prurigo nodules or increased lines on the hands. So those are very common areas that could be affected in darker skin.
Okay, well, unfortunately we're out of time, but I guess what we can tell people is that you don't have to suffer these days. You can go get treatment, see a physician, and get treatment.
Absolutely. Come on into your dermatologist and we can take care of you.
All right. Thank you again to Dr. Naveen Arora, founder of Borealis Dermatology.